Imagine your stomach like the inside of a tough, leathery bag. It's designed to handle strong acids that break down your food. But sometimes this protective lining gets damaged, leading to sores called ulcers. These ulcers, often found in the stomach or the upper part of your small intestine, called the duodenum, can be quite painful. Most ulcers aren't caused by stress or spicy food, as once thought. The real culprit is often a bacterium called H. pylori, which infects the stomach lining. Long-term use of common pain relievers like aspirin and ibuprofen can also contribute to ulcers. These sores don't just appear overnight, they develop gradually. And understanding their causes and symptoms is the first step to protecting your gut health. Stomach ulcers don't always shout out their presence. Sometimes they whisper, making it tricky to recognize them. However, there are some telltale signs that you shouldn't ignore. The most common symptom is a burning pain in your upper abdomen, often occurring between meals or at night. This pain can last from a few minutes to several hours and might be temporarily relieved by eating or taking antacids. Other symptoms include feeling full quickly after eating a small amount, nausea and vomiting, bloating and indigestion and heartburn, a burning sensation in your chest. If you experience these symptoms, particularly the burning pain, it's crucial to consult your doctor. Diagnosing ulcers involves a bit of detective work. Your doctor will start by asking about your medical history and symptoms. To confirm the diagnosis, a procedure called an endoscopy might be recommended. This involves inserting a thin, flexible tube with a camera through your mouth and into your stomach to visually inspect the lining. In some cases, a breath test or stool sample might be taken to check for the presence of H. pylori bacteria. Identifying the cause is key to determining the most effective treatment. The good news is that you can take steps to protect your stomach and reduce your risk of developing ulcers. First and foremost, if you smoke, quit. Smoking weakens your stomach's defenses and makes it more susceptible to ulcers. Limit your use of NSAIDs like ibuprofen and naproxen, especially if you're prone to ulcers. If you need pain relief, talk to your doctor about safer alternatives. Finally, embrace a healthy lifestyle. Eat a balanced diet rich in fruits, vegetables, and whole grains. Manage stress through exercise, relaxation techniques, or hobbies you enjoy. Section 5, seeking help and finding relief. Remember, stomach ulcers are treatable. If you suspect you might have an ulcer, don't suffer in silence. Consult your doctor. With the right diagnosis and treatment plan, you can find relief from the discomfort and get back to enjoying your favorite foods and activities. Taking care of your gut health is an investment in your overall well-being.